Doctors of Reddit, what was a symptom a patient didn't mention that was really important? I had a guy come to the hospital who told me he had seizures every Tuesday like clockwork. This is highly unusual for somebody with a seizure disorder. It wasn't until I asked him about his social history that he told me he's a heavy drinker. I investigated further, and it turns out he binge drinks Thursday, Friday, Saturday every week, then stops cold turkey. He was having withdrawal seizures. This is terrifying, holy shit. Alcohol withdrawal is no joke. It can kill you. Chest pain. Guy denied ever having chest pain, ever. Told us he was able to chop wood and work on his land without any issues. He didn't meet any criteria for additional workup prior to surgery. During his major surgery he had a huge heart attack. A cardiac cath showed that he basically had one very narrow coronary artery that was the only thing getting blood to his heart. His daughters, who were nurses, all swore up and down that he was healthy as a horse and never complained of heart issues. Then his black sheep other daughter arrived and said he actually had told her that he terrible exertional chest pain every time he did anything, but that he didn't want his other daughters to know because they would worry. He died a few days later. If we had known about his symptoms, he would have likely had his cardiac disease diagnosed and treated prior to surgery. Edited for typos, was on mobile during a break at work and didn't notice them until now. Edit 2. Since this post is getting a lot of attention, here is an informative article about chest pain from the Mayo Clinic. It's important to note that women and people with diabetes may not have the classic symptoms of cardiac chest pain. The American Heart Association summarizes some of these differences here. Edit 3. Thanks for the coins. And I'm sorry, but I can't give medical advice over the internet. If you are concerned about symptoms you or a loved one may be having, go to a doctor please. How sad. It is amazing in family dynamics who gets told which portion of the truth. Medical intern here, had a woman come to her complaining about stomach pain, took her full history, did the exam and vitals, she seemed fine, mild fever. Made a preliminary diagnosis of gastroenteritis and presented to my doctor. My doctor, who is female, goes to her and asks why she came to her for something so mild. She says because she noticed blood in her stool. The doc comes out and asks me if I asked about her stool. I did, she said it was fine, and I asked specifically about blood. She goes back in and asks the patient why she didn't mention that to me. Her response, didn't think it was appropriate to say it to a male intern. Turns out she had ulcerative colitis, needed a colonoscopy and long-term medical therapy and possibly surgery. Bro, as someone with Crohn's I talk about my shit like an epic. I have the whole Iliad of the story of my bowels down. I have UC and I do the same, it's the FKN worst with a flare-up. I'm constantly looking to check if there's blood and I don't think there's a person in my immediate family who doesn't know about my bowels. I'm a med student and on my family medicine rotation I was sent to see this woman before the doctor and get a history and physical. She was saying she was having heartburn and just wanted us to give her something to throw up so she will feel better. I thought it was odd and so I went through some more review questions and she said her reflux pain was extending up to the left side of her neck and down her left arm. And that she had been sweating for hours. I cut off the interview short there and went to my teaching doctor to tell him everything and what I thought. Got an EKG. Yeah, she was having a heart attack, had to call an ambulance and get her to the ER. For your entire career don't forget this case. I'm an ER doc. All epigastric pain is an MI until proven otherwise, especially in diabetics and women. I had a patient who needed a small sterile procedure done but had a latex allergy and it was in bright red all over her chart. We used paper charts back then. We had just ran out of latex-free sterile gloves. I went in to tell her she needed to come back in a week when we got them back, then I decided to ask what happened when she came in contact with latex. Her response, I get chlamydia. What even? Was she married or something? I can't think of any reason besides having multiple partners and wanting to hide it to pretend to have such an allergy. Did my sub-I in a level 1 trauma ed a few years ago as a 4th-year med student. Homeless guy with HEPB, HEPC, and HIV came in talking about a rash on his shoulder, how it hurt, had been pretty hot out and that was where he was slinging his bag on. Looked okay, figured it for a sweat rash, he was really in there for food, so was going to give him some cream and a sandwich and send him out the door. Was about to leave when I looked at his chief complaint again, and it also had testicular pain, so I asked him what was going on with his testicles. Lifts up the gown, and he has a tracking abscess through his scrotal skin and through one of his testicles. It was like a worm burrowing through his balls like it was an apple. Oh, it's okay I guess. Ended up calling urology and infectious disease, and the guy ended up leaving against medical advice because we were making him NPO, without food, in anticipation of surgery. Edit, clarified part of story. I can't say I'm surprised. My mother works at a VA hospital, so there is a large homeless population of patients there. So many terrible things. What's so sad is they have free health care if they are VA eligible, which they all are. I had a patient whose main complaint was a wrist sprain. Asked how he fell, and he said he felt lightheaded and fell down the stairs. After about 15 minutes of questions about his heart and other stuff, I asked him if he's had any vomiting. He said he vomits every day. I asked if it's red, and he said it's bright red every time. The kicker is this was his usual yearly appointment. Dude was vomiting blood every day, and not only did not go to the ER, he didn't feel it was worth mentioning at his checkup. So what was his issue? Obviously vomiting blood is not okay, but why was he vomiting blood? I think it ended up being a lower esophageal bleed. 16-0, came in with blood pressure of 60/30. Pale as a ghost. Tons of free fluid in his abdomen on ultrasound. Turned out he had metastatic testicular cancer that had eroded into his aorta and was bleeding into his belly. Come to find out later he had testicle lumps and was too scared to tell anyone. Edit, for those asking, we resuscitated him with blood and fluids and transferred him to the nearest PEDS ICU. He was treated, lived a few months and passed away. It was incredibly sad. I think of him often. Oh fuck, did he live? Sounds unlikely and very very sad. I'm a doctor. These stories are from a few years ago when I saw patients. I am a medical intern, working the ed. Dude comes in with a heart attack. That part's clear as day. Gonna be medically managed, procedure in the morning. I'm about to queue up some nitro paste. It's a cream you put on skin that helps get blood flow to the heart, as my resident had seen him first and said it was okay, and I went through the contraindications as it was just habit at this point. One of them is recent Viagra use. Patient had said no to recent Viagra to my resident when his wife was there. He said yes to me when I asked when his wife wasn't there. He wasn't using it with his wife. Nitro paste was avoided, blood pressure stayed okay, coronary got stented in the morning, discharged the next day. Pro tip, while you toss the family out to do the rectal exam, ask all the questions they won't answer honestly. Okay, time for another one. Working the ed, lady comes in with a seizure, loss of consciousness. She's about 45. We're probably gonna watch her overnight. She's been prescribed tramadol before. I ask how much she takes. She's a nurse, she tells me what the prescription says. I do my usual, ever take double or half, what works for ya? As a means to get people to be honest. She's nervous. Well, these things can bother people with seizures, I say. She's more nervous. I then try the, look I don't give a shit, just lay it on me and we'll unpack it. She's taking 12 at a time, 4 to 6 times a day. She was about an hour late with the pills and seized. If I remember right, clearing 3 to 4 gm of tramadol per day. People are getting high on 0.05 to 0.2 grams. She's doing a gram every few hours. Call the resident. Resident calls pharmacy, I call poison control. We figure out a med dosing that would probably kill someone but is enough to cause her to not withdraw. She lived. I was pretty impressed that we titrated that down over the days she was in the hospital. Saw a patient during follow-up for a gynecological cancer. She said she felt great, exam was normal. She was relieved, but she was so anxious it set of my medical spider sense, so to speak. I decided to push a bit further, which led to this conversation. Me, so you said you felt good? Absolutely nothing else bothering you? Her, oh, you know, some small things, nothing having anything to do with this. Me, well, why don't you tell me anyway? Her, well, I kind of have this weird lump on my belly, a sweat gland or a greasy nodule or something. Doesn't really bother me, but I might get a dermatologist to have a look at it if it ever needs to be removed. Me, I see. Could you show it to me? She showed me, and I saw a skin metastasis, clear as day. Don't know how the story ended because I moved to different service immediately after, but if I had to guess, her life expectancy was probably measured in months. Anxious weird lump she knew. She was probably in denial. Thank you for watching. I hope that you liked this video. Be sure to subscribe for more videos like this one.